COVID-19 and pregnancy. This video is aimed at health workers caring for pregnant women before, during, and after delivery to outline current knowledge regarding COVID-19 and pregnancy, and to guide management of pregnant women and newborn infants with possible or confirmed COVID-19. Risk of COVID-19 in pregnancy. There is very little information currently available on COVID-19 infection in pregnancy and in the postpartum period. However, there is no evidence that pregnant women present with different symptoms or are at higher risk of severe illness than the general population. There is no evidence of mother-to-child transmission. Evidence of increased severe maternal or neonatal outcomes is uncertain and limited to infection in the third trimester, with some cases of premature rupture of membranes, fetal distress, and preterm birth reported. Preparing for COVID-19. It follows that disruption of the normal schedule of maternal and child services carries a greater risk of pregnancy and neonatal complication than any risk from COVID-19. Facilities need to prioritize the continuation of antenatal care, delivery, and postpartum care, and especially ensure no disruption to emergency obstetric care. Health workers need to plan for staff and supplies, including extra attention to infection prevention and control. Infection prevention and control feature in separate videos in this series. Antenatal care. Prior to delivery, a hospitalized pregnant person with suspected or confirmed COVID-19 infection should be managed in accordance with the infection prevention and control guidance for other COVID-19 patients. Intrapartum care. Patients with suspected or confirmed COVID-19 who are in labor should be placed in an isolation room. The door should remain closed with appropriate isolation signage placed on the exterior door. The patient should remain in isolation throughout their hospital admission. During their delivery, healthcare staff must wear appropriate PPE. Cesarean section should only be undertaken when medically justified and is not specifically required for a pregnant woman with suspected or confirmed COVID-19. Postpartum care. Infection control precautions for mothers with COVID-19 should continue after delivery. A small number of cases have been reported of infants confirmed with COVID-19, and most have experienced mild illness. Infants born to mothers with suspected or confirmed COVID-19 should be fed according to standard infant feeding guidelines, while applying necessary precautions for infection prevention and control. All confirmed or suspected COVID-19 mothers breastfeeding or practicing skin-to-skin contact or kangaroo mother care should practice respiratory hygiene when handling or feeding their child. This includes hand hygiene before and after contact with the child, and frequent cleaning and disinfection of surfaces, and wearing of a face mask if the mother has respiratory symptoms. COVID-19 mothers too ill to care directly for their infants should be encouraged and supported to express milk and provide it safely to the infant while applying appropriate infection prevention measures. Suspected or confirmed COVID-19 mothers should be enabled to remain with their infants day and night using the infection control precautions previously described, and to practice skin-to-skin contact or to kangaroo mother. This is particularly important immediately after birth during establishment of breastfeeding.